So for our assignment, I think the assignment was titled Evaluation Reflection for Shoulder. I have unfortunately unable to see any actual in-person shoulder issues, so we went through a mock patient. So the mock patient was with a rotator cuff damage to the supraspinatus. So question one was my evaluation comprehensive? Why or why not? For my first shoulder evaluation, I could have been more thorough just to make sure, I got every degree of motion that I was targeting. There was just some little things that I forgot to do, like for the evaluation, just asking additional details, what does it feel like at its worst? Sometimes that can, I learned about that today during one of our plan of cares for another patient, where he asked, what does the pain feel like now, and what did it feel like at its worst? Just so you have kind of like this general area senses. But for other evaluations, I feel like I did pretty well. I asked enough key terms to kind of solidify and I direct my attention to rotator cuff. The only range of motion, or I guess manual muscle test that I didn't really think of initially was the Apley scratch. I mean, I know it's not a manual muscle test, but it is as a functional assessment. I didn't really think of that aspect, but that can help indicate exactly if there's other underlying issues. Did my palpation inspection and objective measurements lead to a confident diagnosis? My initial diagnosis was, after they started describing the symptoms, was a slap lesion. However, as the evaluation went on, I shifted my attention more towards rotator cuff because of the pain primarily at their flexion and flexion past 90, and then the abduction, having difficulty, they're having pain or difficulty keeping it at that 90 degree. Did I incorporate evidence into my evaluation? Why or why not? I thought that one was the hardest part, of the evaluation. Special test purposes, I did O'Brien's because I'm pretty familiar with it, and I've seen it come up positive in a clinic. However, another one that I did was empty cans with their hands out, 45 degree, applying pressure. Then lastly, I think I could have I think I could have done more special testing to isolate it better, either with like Gerber liftoff or lag sign, or just to make sure that I'm ruling in other potential areas. What did I do well? Discuss 2 areas. Well, I think I did well with identifying majority of the range of motions that targeted pain in the rotator cuff, specifically with anterior aspect of it. Another thing that I did well was, I think I did really well with working through, if something didn't come up right, I did a good job with shifting my attention, because originally I thought it was a slap lesion, so that was the direction that I went. But once I found out that specifically, like, he wasn't able to sleep at night, then that kind of cued me into another direction. and especially after the other tests that I performed. And what areas can I improve, or how will I improve in those areas? I could have done a better job with the resistive range of motion. I didn't really target everything, so I think I could do a better job of testing for those things, and then just being a little bit more confident in the testing. The diagnosing, wouldn't say that I'm not confident in diagnosing. It's the testing that I'm a little skeptical about. Just because I know how to perform it, I'm not as confident with what initially I'm isolating. So I definitely think I could work on just being more confident in that, and yeah.